Hello friends, welcome back to my channel Medicine 101. Today we'll talk about aortic stenosis. Okay, so before I have already uploaded one video based on the mitral stenosis. So let me tell you before starting the topic what is stenosis. So stenosis means whenever we will see that will not whenever the valves that they will not able to open completely, there will be partial opening of the valve. For example, if it's over here that for example the mitral valve. Now we're talking in terms of the the aortic valve over here. So just try to understand from here. So for example, is the normal valve. Okay. Now whenever we will see, there will be narrowing of the valve. We will see the narrowing of the valve. As a result, very little space is over here to eject the blood from the ventricles to the aorta. So this type of problem we can see in terms of these things. So stenosis. Let me write one second over here. There will be a partial opening of the valve, not complete opening. Okay, partial opening of aortic valve. Okay. Now let's talk about some points, some introductions points related to this topic. Okay. So this type of the thing we'll see what in terms of the pediatric age group. Okay. Now see, is the most common. If I say most common, okay, valvular lesions. Most common valvular lesions over here. Okay. Or we can say that is the most common cause for the valvular lesions in these cases. Now we'll talk about different kinds of the etiologies. What are the causes for aortic stenosis? Okay. So let's write it over here. So as I said, this is the most common cause for congenital let me use this one. Congenital lesions. Okay, now see. For example, if I just show you with the different color over here, for example, it's the normal normal aortic, valve over here. This one. Let me show in this way. Left it's 1, 2, for example, there's 3 over here. Okay. Now, whenever we see the damaging on the aortic valve over here, whatever the figure we'll get in these cases, just like this. We'll get the narrowing of the aortic valve. So, whenever it will get damaged aortic valve is the normal one. Okay. Now we'll talk about in terms of the etiologies. So what are the etiologies? Now see, in terms of the etiologies, you can say the first thing first. So in terms of the pediatric age group, we will get bicuspid aortic valve. You will get the bicuspid structures over here. This is the congenital, and where we will see this type of thing in terms of the pediatric age group. Pediatric age group over here. Okay. And in terms of the adults, you can also see, but where we will see the degenerative calcifications. In terms of the adults, in terms of, let me tell once more over here, in terms of the children, in terms of the pediatric age group, we will see the bicuspid aortic valve over here. This is the congenital. Okay. Now in terms of adult, we can get over here the degenerative calcification. What do we mean by this? What do we? Okay, the calcification. Okay. In these cases, for example, any individual who is having atherosclerosis, as a result, we will see there will be narrowing of the blood vessels. For example, within the abdominal artery, within the aorta, within the coronary artery. Okay. So in these cases, whenever we will get the atherosclerosis, see, Now if I just show you over here, whatever the problem we'll see. For example, we got the atherosclerosis in the aorta. Now see, is the we're getting the calcifications or atherosclerosis, for example, in these regions. Now there is a chances also to get calcified these regions also. Calcified these regions along with this part. Okay. So whenever it will be calcified, try to understand from here. Okay. As a result, we will see different kinds of the growth factors of the fibroblasts. They will come over here. As a result, they will convert into what? Fibrocalcifications. After getting calcified, whenever the fibroblasts, they will come over here. They will convert these whole things over here in terms of the fibrocalcification. And whenever you are getting the fibrocalcifications, they will do what? They will just do the differentiations. They will do the differentiations of what? Okay. This will get what? The fibrocalcification. They will convert the fibroblast over here into the osteoblast. And whenever we are getting the osteoblast, try to understand from this figure. Whenever we are getting the osteoblast, definitely there will be the structures for the bone matrix like structures. It will be what? Hardened. It will be totally too much hard. So there will be too much problem for the opening of the what? Of the aortic valve. Now whenever we are getting this type of the structures, now we can say that we can use the what? Balloon dilations. We can use for these things, the first thing that can come in our mind, that we can use the balloon dilations. But whatever the problem is in terms of the balloon dilations, there is chances for the damaging of the balloon dilations in these cases. So there will be problem at the valvular leaflets level. So if we use over here, if we let me write in this way, balloon dilations. See, in these cases there is a chances for the damaging of the valve leaflets. So whenever it will get breakdown, the valve leaflets, they will go within the brain, the parts, and they can cause a stroke over here. It can cause a stroke over here. Okay, this is the second cause for the for taking place of the aortic stenosis. Okay. Now the third cause we can say I have already experienced in terms of the rheumatic fever. Whatever the problem which in terms of the rheumatic fever, for example, if you see this is the valvular structures over here, this is the valve cusps. Okay, in these cases, this is the anterior leaflets, the posterior leaflets. Now whatever the problem which in these cases, we will see the calcifications or the the fibroblasts or different kinds of the growth factors will come over here and they will just try to fuse these regions. Whenever we will get the fusions of these cusps, as a result, we will see the surface area of the valve. Okay, the surface area, normally it is around 2 to 3 centimeter square, but whenever we will get the fusing just like this one, the surface area that will be less than 1 centimeter square, and in this times we will see the symptoms that will come over here, the symptoms that will appear. Okay, and in terms of the fourth group of the etiologies over here, we can say in terms of the radiations. So in terms of radiation, now see, when we are talking in terms of the radiations, for example, an individual who is having the Hodgkin lymphoma or just need to do the breast cancer someone is having. Okay, in these cases there is a chances, in terms of the mediastinal side. So whenever we are doing the radiation in terms of the mediastinal side, there is a chances for having the aortic stenosis from there. Okay, so the different kinds of the cells, from the tumor cells, the different kinds of the product that will be secreted and that will go over here and that can cause the damage. Okay, now in terms of mediastinal, so what in terms of the Hodgkin lymphoma, or you can say in terms of the breast cancers, in these cases there is chances for these things. Okay, so these are the etiologies. This is whatever I have discussed till now. These are the etiologies in terms of the aortic stenosis. Now we'll talk about whatever the clinical manifestations we can get over here. So let's write over here the clinical manifestations. Okay. See, whatever the clinical manifestations will get in these cases. Now see, at first if we just compare in terms of the ratio with the male and female, it's around 2 to 4:1. That means the male are having the more chances for having this type of the problem. Now in terms of the two types of the clinical manifestations, what can you get over here? We can get the syncope within the brain. There will be the problem because what, whenever the syncope, what, whenever the insufficiency of the blood circulations, okay, whenever the brain that will get less amount of the blood, not more than sufficient, it will get less blood. As a result, we can see this various types of the problems in terms of the brain, that is known as what, the syncope over here. Then we can get over here in terms of we'll get the angina. Why? Because we'll get over here left ventricular hypertrophy. Just try to understand from here that, let me, so once again, for example, is the left ventricle over here, okay. Whenever it is fusing, whenever we are seeing the stenosis wire within the aortic valve level, so as a result we will see the blood that will be not able to go from left ventricles to the aorta. As a result, the blood that will keep on accumulating, and whenever the blood that will be accumulating over here, that will apply the pressures on the all of the myocardium, all of the in these cases all of the myocardium. As a result, we will see the stretching of the left ventricles, and that will cause the what, left ventricular hypertrophy. Left ventricular hypertrophy. Okay. Now we can get also the we will get the angina because there is chances for having the left ventricular hypertrophy. Okay. Along with that, we will also get the dyspnea. This type of the clinical manifestations we can get. Now, as far as the auscultation findings are concerned, so whatever thing we see over here, okay, we'll see in these cases slow rising pulse. That means the pulse that will get rising, but the problem, it will rising slowly. Okay, in these cases. Now the one most important thing that will get over here, that is known as anacrotic shudder. What is anacrotic shudder? Whenever we are getting the stenosis over here, as a result, the left ventricle, the pressure within the left ventricle for having the left ventricular hypertrophy, that will be more. So the ejection velocity, that will be also more. Okay. So in this case, we can write it over here. The ejection velocity, that will also get increased in these cases. Okay. Now another type of one we will see in terms of the apex bit. So whenever try to understand, whenever you will just keep your hand on the side of the in this case, in these positions, so you will see whenever the pulse will go, or whenever you will see that there will be what the blood will go from the left ventricles to the aorta. As a result, we will see, because for having this property, you will see that this, for example, you are just keeping this finger, so this fingers that will go upward. Okay, that will come upward in the right side over here. So in terms of the apex bit, you can see also this type of thing. Now we'll talk about whatever the problem you will see in terms of the different types of the murmurs and different kinds of the problem in terms of the heart sounds over here. Okay, so let's write about them right now. So let me write it here. Whatever the problem we will get in terms of the opening of the valves. Now see, whenever we are talking in terms of the opening of the valve, for example, I am just taking in this way. Okay, now see. I'm just considering this the right atrium, left atrium, or right ventricle, left ventricle. Okay. Now see, whenever you are getting the whatever the problem, let me show over here. For example, this is the aortic valve. We are getting the hypertrophy here within the left ventricle. As a result, we will see the pressure here, that will be more. Okay. Now try to understand. We know basically that the aortic valve that closes before pulmonary valve. So around we will get the time lag, or we can say the time gap around we'll see that 30 millisecond. But the problem is over here, whenever the left ventricular hypertrophy will get, or will get the stenosis in these regions in the aortic valve. Okay, now try to understand from here, the pressures within the left ventricle that will be more. So whenever the blood that will keep on coming from the left atrium to the left ventricle, the pressure that will keep rising suddenly, that will what? We will see the pressure that will rise very quickly over here. Okay, as a result we will see the blood. Okay, try to understand from here. So the blood from here that will be ejected over here soon. Okay, so in these cases we will see at that will take time, because whenever we are getting over here less amount of the blood, try to understand from this figure, the less amount of the blood that will go over here from the aorta to the rest of the body parts, less blood will go, but it will take more time. It will take more time because of the narrowing of the valve over here. Try to understand. The less amount of the blood is going. Why? Because of the narrowing of the valve. The pressure will be more. So the volume will be what? Whenever the pressure will be more, the volume will be less. So that's why in these cases we will see the pressure that will be more, but the volume, the amount of the blood that will go less over here. Okay. So whenever it is taking more time to push the blood from the ventricles to the aorta, as a result we will see there will be the time lag in between the closing of the mitral valve, sorry, in the aortic valve and or pulmonary valve. The time gap that will be less than 30 millisecond. That will be less than 30 millisecond in terms of the aortic and the pulmonary valve closure. Normally, what do we know? The aortic valve is supposed to be closer than the pulmonary valve, but here we are getting the stenosis of the aortic valve. As a result, in the aortic valve that will take more time to push the blood from the left ventricles to the aorta. Okay, so there will be closure of the there will be closure of what? The aortic valve. Okay, just one set of the, we can say in terms of the aortic pulmonary valve over here. So the time lag or time gap in between the closure of the aortic valve and the closure of the pulmonary valve, that will be less than 30 millisecond over here. Now we'll talk about different kinds of the heart sounds over the murmurs. Okay, now normally what do we know, that whenever you are getting over here the hypertrophy in this region, as a result we will see the blood that will keep on accumulating over here. So we will also see the blood that will also keep on accumulating where? Within the left atrium, and that will go where? Within the lungs. So whenever we will see this type of the thing, so what type of the problem we will see? So the blood within the, whenever it will keep on accumulating within the left ventricle, it will cause the what? Left ventricular hypertrophy. Okay, that will also cause arterial hypertrophy also. Arterial hypertrophy. Now whenever a hypertrophic that will squeeze the blood, that will send the blood against the hypertrophic or ventricle, at that time we'll see the production of S4 heart sound. So whenever we'll get the S4 heart sound, whenever thus, try to understand the hypertrophic atrium that will just send the blood from what? From the atriums to the ventricle, and at that time we are also seeing the ventricle that is also hypertrophic. So that means you can say whenever the blood will come from the hypertrophic atriums to the hypertrophic ventricle, as a result we can see what? The presence of the S4 heart sound over here. Now if you say in terms of the murmurs over here, for example is the S1, this is the S2, is the S1. Normally what do you know, that after S1 what will come? Ejection click. Now see, whenever the ejections click, that means the blood that will go from here in these regions to this outside, from the ventricles to the aorta, it will go to the different body parts. Now whenever we are seeing that the blood that will, the pressure within the left ventricle that will rising very soon. As a result we will see the ejection click. We can say over here the ejection click. For example, normally what we ejection click is supposed to be in these positions, but in these cases we will see the ejection click that will be closer to the S1. That will be closer to position. So we can say that in these cases we will see what? The pressure in left ventricle that will be rising. Okay, that will increase. As a result we will see the early opening. We will see early opening of aortic valve. So whenever we see the early opening of the aortic valve, as a result we will see whatever the thing, the ejection click that will be nearer to the S1. Okay, and from here we will see different kinds of the abnormal heart sound. We'll get on top of the murmur from here. That will go in these regions first with the what? In the systole. In systole we will go to the peak, and again it will come back to the rest over here. Okay. Now this type of the murmur, that is known as crescendo decrescendo murmur. So what is crescendo? Crescendo decrescendo murmur. See, whenever you are getting the left ventricular hypertrophy, as a result the pressure within the left ventricle that is increasing. So as a result we are seeing the early opening of the aortic valve. As a result, we will see over here the ejections click that will come closer to the S1. Whenever the ejection click that will come closer to the S1, we will see the production of the abnormal heart sound that is known as the murmur. Here we will get the productions of the murmur that will be originated from here, and that will go to the peak at the systole, and that will come back against the S2. Now this type of the murmur that is known as crescendo decrescendo murmur. Okay, crescendo decrescendo murmurs over here. Okay, now we'll talk about it's different kinds of the the treatment, or you can say investigations over here. Now in terms of the investigations, what can you get over here? Let's erase this part. In terms of the investigations, what can you do over here? In these cases, we can do the echo. For example, we can do the echo. And whenever you are doing the echo, we can understand from the valve surface area. For example, if we see the valve surface area is 2 to 3 centimeters square, then we can say it's the normal, around it's the normal over here. Okay. Now if we get 1.5 to 2 centimeters, at that time we will see the mild, there is a chances for the mild stenosis of the aortic valve. And if we get 1 to 1.5 centimeters square, we will get over here that can cause the moderate aortic stenosis. And if we get less than 1 centimeter square, in these cases it will be severe. It will be severe. Okay. So as far as the echo findings are concerned. But the investigations of the choice in these cases, we can do the what? We can do the CT scan of the chest. We can do the investigation of the choice with CT scan over here. Okay. Along with that, you can also do the coronary angiography. You can also do the coronary angiography. Now, in these cases, this is the morbidal disease. So, in these cases, we will see the death. When you will see the death over here, now see any individual who is having the syncope. Along with the syncope, we are seeing what? For example, we are getting the angina. So, there is a chances for the individuals to get died within the 3 years. Okay. Now, if you see one more symptoms is getting added over here, the dyspnea. This individual is having the chances for die within 2.5 years. And if we see for this type of thing, congestive heart failure, if we see the development of the congestive heart failure in these cases, that will take around 1.5 years. That means within 1.5 years we will see the individual is getting died over here. Now, what about the treatment? We were talking down to the treatment of choice of the treatment over here. Okay, let's write it over in terms of these things. Okay. In terms of the treatment, we can do whatever thing. This one. That means we can do the catheter aortic valve replacement. we can do transcatheter aortic valve replacement. In this case, treatment of choice in these cases. Okay, so along with that, we can also do in terms of whenever we are seeing the hypertensions we are getting over here. As a result, we can see. So we can use the AC inhibitors. We can also use in terms of the beta blockers. We can also use, but we have to see the conditions of the patient in these cases before using this drug. But the treatment of choice you can see in these cases. Okay, that will be what the transcatheter aortic valve replacement. That is the treatment of choice. So guys, this was all about the aortic stenosis in terms of its pathogenesis, in terms of the etiologies and treatment, and the different types of the diagnosis we can do here. So if you think this video is helpful for you, please do like and subscribe my channels, and see you in the next video. Okay, so thanks for watching.